What are the risks of nerve damage during hyoid suspension? Have you ever wondered about the potential risks involved in surgical options for sleep apnea, specifically hyoid suspension? This procedure can be a game changer for many, but it does come with some risks, including nerve damage. Let's break it down. Hyoid suspension is a surgery aimed at repositioning the hyoid bone to help keep the airway open during sleep. While it is generally safe, the neck's anatomy poses some risks. Important nerves are located near the hyoid bone, and these can be affected during surgery. The hypoglossal nerve is one of the key nerves at risk. This nerve controls tongue movement. If it gets damaged, you might experience weakness or paralysis in the tongue muscles. This can lead to difficulties with speech or swallowing, which can be quite concerning. Another nerve to consider is the superior laryngeal nerve. This nerve impacts sensation and muscle function in the larynx or voice box. If this nerve is injured, you may notice changes in your voice or altered sensation in your throat or tongue. While the risk of nerve damage is relatively low, it can happen if surgical instruments or sutures accidentally compress or damage these nerves. However, when performed by experienced surgeons, these complications are uncommon. In addition to nerve damage, other risks associated with hyoid suspension include infection and pain. If an infection occurs, it could potentially affect nearby nerves if it becomes severe. Device-related issues, like broken or dislodged screws, can also arise but are typically manageable. Despite these risks, many patients find that the benefits of hyoid suspension outweigh the potential complications, especially if other treatments, like continuous positive airway pressure therapy, are not effective. This surgery is minimally invasive, usually requiring just a small incision, and recovery tends to be less painful compared to other airway surgeries. Moreover, if complications do arise, the procedure and implants can often be reversed. It is essential to discuss all potential nerve-related complications with your surgeon before the procedure. This way, you can understand the likelihood of these risks and how they might be managed. In summary, while nerve damage is a known risk during hyoid suspension, it is rare. With careful surgical technique and proper patient selection, the chances of complications can be minimized.